health problems affecting the brain. Extra salt in your meal seems harmless and kicks up flavor, but it is a risk factor for hypertension. A study published in JAMA Neurology finds that high blood pressure can stall brain power. Dr. Rebecca F. Gottsman spent 20 years studying the blood pressure and mental performance of 13,000 adults ages 48 to 67 years old. Participants with high blood pressure experienced a nearly 7% decline in brain power, that is equivalent to aging 2.7 years compared to those with normal blood pressure. Even pre-hypertension damages a participant's brain. Alzheimer's disease comes earlier for such population. So both young and elder should keep their blood pressure, as well as the habits of healthy eating and regular exercise for a normal functioning brain. However, high blood pressure is not the only risk factor for cognitive decline. Researchers from the Johns Hopkins Center on Aging and Health in Baltimore found those suffering from hearing loss had a 30 to 40% increased chance of cognitive decline compared to those with normal hearing. Hearing loss is also associated with depression and sleep apnea. When noise is too loud, it begins to kill the hair cells and nerve endings in the inner ear. The louder a noise, the longer the exposure, and the closer you are to the noise source, the more damaging it is to your nerve endings, or your hearing. Protect your ears as often as you can against noises over 80 decibels. This includes wearing earbuds and covering your ears when they are not on hand. To give you some perspective, a normal conversation is 60 decibels, the subway is 90 decibels, a concert and car horn are both 115 decibels. Not getting enough sleep does not just make you cranky, it seriously challenges your cognitive skills. A study shows in the journal Sleep shows elder men with poor sleep quality and nightmares were more likely to suffer from cognitive decline. Another study published in the Journal of Clinical Sleep Medicine found both older men and women who get less than 6 hours of sleep per night or more than 9 scored lower on cognitive tests than those who get 6 to 9 hours. Other problems with sleep apnea are diabetes, and even breast cancer. Set up an ideal sleep environment and try to sleep on your back. Doing so does not only help you sleep, but it prevents back and muscle aches. A study of over 6,000 adults of an average age of 50 years old was published in Neurology regarding body weight and brain functioning. At the start of the study, 38% were overweight. When the study concluded 10 years later, these participants experienced a 22% decline on their cognitive test compared to those who were a healthy weight. Too much of sweets, soda, caffeine, and alcohol can also hurt a person mentally. Adopt healthy eating habits, the cleaner the food, the better. The way a person walks or gait is associated with cognitive decline. At the 2012 Alzheimer's Association International Conference, the Mayo Clinic presented findings from a study that showed a shorter amount of steps per minute, as well as overall stride, put a person at risk for mental impairment. In a separate study presented at the Alzheimer's Association International Conference in Copenhagen, participants with slow gait were twice as likely to develop dementia within 12 years. If you correct your walking style, you can protect your brain. Proper gait helps to reduce walking and running-related injuries also. According to research from Rush University Medical Center in Chicago, you get by with a little help from your friends, and so does your brain. After measuring the social activity levels of over 1,000 adults ages 80 and older, researchers found the least active participants experience the most cognitive decline. Weekly get-together are an easy way to spend time with friends and family, as well as remind you how important it is to stay connected. A study published in the Archives of Internal Medicine found people with low levels of vitamin D were 60% more likely to suffer from cognitive decline. Soak up the sun with properly applied SPF, of course. Supplements are available, though some science suggests they're not entirely useful. In which case, there are plenty of D-rich foods you can add to your diet, including milk, eggs, mushrooms, and salmon. Thank you.